My name is Dr. Charley Gates. I'm an orthopedic surgeon with Orthopedic Associates of Meadville. I split time between Meadville and Titusville, spending most of my time at Titusville Area Hospital. I have a general orthopedic surgery practice, and so I see a wide variety of patient complaints. Everything from carpal tunnel syndrome, which is numbness and tingling in the hands, to knee arthritis and hip arthritis, and knee pain and shoulder pain. I perform a lot of knee replacements, fracture work like hip, wrist, and ankle fractures, carpal tunnel releases, and then knee arthroscopy and shoulder arthroscopy. So I always explore non-operative treatment options with my patient first, because those are the safest and often they're the most effective. Sometimes it's all the patient needs, so we're always looking for the simplest answer. And non-operative management consists of things like anti-inflammatory medications, exercise program, physical therapy, sometimes injections. When it comes to surgery, I'm ready to do that. That's what I love. That's what I dedicated 10 years of my life to learning. And so when it comes to that, I'm happy to offer that to my patients as well. I mean, my ultimate goal is to serve the patient in front of me. I consider medicine a vocation, something I'm called to serving your fellow man. And so my goal is a satisfied patient. And it takes many different forms. For some people, it's a successful surgery. For some people, it's taking time to listen to what they're actually saying and figuring out another solution to the problem that's less risky. And sometimes it's just following the standard of care for moving through a treatment regimen of something like knee arthritis, starting with basic things like home exercises and anti-inflammatories, and progressing to something like a knee replacement surgery. Yeah, when I was in high school, I played varsity basketball. It was a very fun time in my life. I wasn't good enough to play in college, so that was the peak of my athletic career. And in the middle of it, I had a bad knee injury. I tore my ACL. I had it successfully repaired by the local orthopedic surgeon and made a comeback. And that was a great experience for me. And I thought, wow, if I could do that every day as a job, that'd be pretty cool. And so that got me interested in orthopedic surgery. I would say absolutely come in. I always sit down and listen to what the patient has to say, and I enjoy having conversations with my patients. It never hurts to have more information. And I'm never pushy, I'm not a salesman. I lay the options and the facts on the table, and the patient and I walk through and decide what fits them the best. Sometimes it's surgery, sometimes it's not. I have many patients who are on the fence with surgery, and I tell them, look, orthopedics is elective. That means that you decide when you're ready. And so we make the decision together often. I think what I offer that's unique is a really tailored approach to patient care. So I've got all of the treatment capacities that other surgeons have, from technical surgeries to injections to standard of care treatment algorithms. But where I think I really shine is taking care of the fellow person in front of me and sitting down, actively listening to what's going on, and then tailoring a treatment solution specifically to them.